Hey, welcome back to the channel, and if you're new here, I'm so glad you found us today because what I'm about to share with you could genuinely change the way you feel every single day. I'm Dr. Harper Collins, and today we're diving into something that I get asked about constantly, and I mean constantly, by my patients, by viewers in the comments, by people who reach out through email. The question goes something like this: Dr. Collins, why do my feet feel like they're constantly tingling? Why do my hands feel numb when I wake up in the morning? Why does it feel like there are pins and needles shooting through my legs even when I'm just sitting still doing nothing? And if you're nodding your head right now, if any of that sounds familiar to you, I want you to stay with me because this video is specifically for you. Now, before we get into the solution, and I promise you we will get there very soon, I need you to understand something first. That tingling, that numbness, that burning sensation that so many people over the age of 60 experience every single day, it's not just something you have to live with. It is not simply a normal part of getting older that you just have to accept and push through. That is one of the biggest myths in senior health, and it frustrates me deeply because when people believe that myth, they stop seeking answers, they stop looking for solutions. They just suffer in silence, thinking this is just what aging feels like. But here is the truth, and this is coming from years of clinical experience and a deep dive into the research. Nerve damage, particularly the kind that causes that tingling, numbness, and burning that so many of you are experiencing, can be addressed. It can be improved, and in many cases, it can be dramatically reduced in as little as 2 weeks when you give your body the right tools it needs to start repairing itself. And one of the most powerful tools, one that is backed by solid scientific research, one that your body may be critically deficient in right now without you even realizing it, is a single vitamin that most people over 60 are not getting nearly enough of. So stay with me. Don't go anywhere, because by the end of this video, you are going to understand exactly what's happening inside your nerves, why it gets worse as we age, which vitamin can make the most significant difference, and how to use it properly to start feeling real results. This is information that can genuinely make your life better, and I don't say that lightly. Let's start by talking about what's actually going on inside your body when you experience nerve damage. Because I find that when people understand the why, they become much more motivated to actually follow through with the what to do about it. And that understanding starts with something called the peripheral nervous system. Now, your nervous system is essentially the communication highway of your entire body. Your brain sends signals, your nerves carry those signals, and your muscles, organs, and skin respond. It's a beautiful, elegant system, and when it's working properly, you don't even think about it. But when that system starts to break down, when those nerve fibers become damaged or degraded, the signals get disrupted, they get scrambled, and the result is exactly what so many of you are experiencing. Tingling sensations, numbness, burning, sharp stabbing pain, weakness in the limbs, sensitivity to touch, even difficulty with balance and coordination. This is what's called peripheral neuropathy, and it affects an absolutely staggering number of people over the age of 60. We're talking about tens of millions of Americans alone who are living with some form of this condition right now. Now, here is something really important I want you to understand. The most common cause of peripheral neuropathy that I see in patients over 60 is not what most people think. Yes, diabetes is a major contributor. Yes, certain medications can cause nerve damage. Yes, alcohol consumption plays a role. But one of the most common, most overlooked, and most easily correctable causes of nerve damage in older adults is a deficiency in a specific vitamin, a vitamin that your body's ability to absorb drops significantly as you age. A vitamin that plays such a fundamental role in nerve health that without adequate levels, your nerves literally begin to deteriorate. That vitamin is vitamin B12. And I know some of you might be thinking, oh, B12, I've heard of that before. But I promise you, you have not heard about it the way I'm going to explain it to you today, because most people have a very surface level understanding of B12, and they have no idea just how critical it is specifically for nerve repair, and they have no idea how severe the consequences of being deficient truly are. So let's go deep on this. Vitamin B12, also known as cobalamin, is one of 8 B vitamins, and it is absolutely essential for the proper functioning of your brain, your nervous system, and your blood. Now, what makes B12 so uniquely important for nerve health comes down to a structure called the myelin sheath. Think of your nerve fibers like electrical wires. The myelin sheath is the insulation that surrounds those wires. It's a protective coating that allows electrical signals to travel quickly and efficiently from one place to another. Without that insulation, without a healthy myelin sheath, those signals get disrupted. They short circuit, they fire incorrectly, and the result is everything we just talked about: the tingling, the numbness, the pain, the weakness. Here's where B12 comes in. Vitamin B12 is absolutely critical for the production and maintenance of myelin. Your body needs B12 to synthesize myelin. It needs B12 to repair myelin when it becomes damaged. And when your B12 levels drop too low, the myelin sheath begins to break down. It starts to deteriorate. And as it deteriorates, you start experiencing those symptoms of peripheral neuropathy. This is not a theory. This is well-established, peer-reviewed science, and the research is very clear on this point. Now, why is this especially relevant for people over 60? Great question, and here is where it gets really important. As we age, our bodies become significantly less efficient at absorbing B12 from the food we eat. Here's why. B12 absorption is a complex process that requires multiple steps. First, you need adequate stomach acid to release B12 from the food proteins it's bound to. Second, you need a substance called intrinsic factor, which is produced by the stomach lining, and intrinsic factor is what allows B12 to be absorbed in the small intestine. Now, as we get older, stomach acid production decreases, intrinsic factor production decreases, and the result is that even if you're eating B12-rich foods every single day, your body may only be absorbing a fraction of what it actually needs. And this is not a small issue. Studies have consistently shown that somewhere between 10 and 30% of people over the age of 50, and the numbers go even higher after 60, have some degree of B12 deficiency. Some estimates put the number even higher when you account for those who are in the low normal range that many conventional labs still consider acceptable, but that functional medicine practitioners, including myself, know is often not sufficient for optimal nerve function. There's another factor that makes this even more concerning, and that is medication. Many of the medications that are most commonly prescribed to people over 60 have B12 depletion as a side effect that is rarely discussed. Metformin, which is used for diabetes and blood sugar management, is a big one. Long-term use of metformin has been clearly shown to reduce B12 absorption significantly. Proton pump inhibitors, the heartburn medications that millions of people take every single day, like omeprazole and pantoprazole, these also reduce stomach acid and therefore reduce B12 absorption. H2 blockers, blood pressure medications, even some antibiotics can affect B12 levels over time. So if you're on any of these medications and you haven't had your B12 levels checked recently, that is something to take seriously. Now let's talk about what the research actually says about B12 supplementation and nerve repair, because I want you to understand just how powerful this vitamin can be when you're deficient and you start giving your body what it needs. There have been numerous clinical studies over the years looking at B12 supplementation in patients with peripheral neuropathy, and the findings are genuinely exciting. Multiple studies have shown significant improvements in nerve conduction, meaning the speed and efficiency with which nerves transmit signals following B12 supplementation in deficient patients. Research published in respected medical journals has demonstrated reductions in pain, tingling, and numbness in neuropathy patients who were given B12. Some studies have shown measurable improvements in nerve function within as little as 2 weeks of starting supplementation, which is where that 2-week time frame in our title comes from. Now, to be clear, the degree of improvement depends heavily on how deficient you are, how long the deficiency has been present, and the underlying causes of your neuropathy. But the research is clear that addressing B12 deficiency can lead to real, meaningful improvement in nerve symptoms. One particular form of B12 has shown especially promising results for nerve repair, and this is something I really want you to pay attention to. It's called methylcobalamin. Now, most B12 supplements you'll find on the shelf contain a form called cyanocobalamin. Cyanocobalamin is the synthetic form that has been used in research for decades and is perfectly fine. But methylcobalamin is the biologically active form. It's the form that your body can use directly without having to convert it first. And when it comes to nerve repair specifically, methylcobalamin has shown some particularly impressive results in the research. There are studies specifically looking at methylcobalamin and peripheral neuropathy that have shown not just symptomatic improvement, but actual nerve regeneration, real structural repair of damaged nerve tissue. And that is remarkable when you think about it. Your body has the ability to repair damaged nerves, and methylcobalamin is one of the most powerful tools available to support that process. Now, let me tell you about the dosing, because this is where a lot of people go wrong. They pick up a B12 supplement from the pharmacy, they see 500 micrograms on the label, and they think, great, that should do it. But the science tells a different story, particularly for people who are already deficient and experiencing symptoms. For general maintenance and prevention in someone over 60, doses in the range of 500 to 1,000 micrograms daily are often recommended. But for someone who is already deficient, who is already experiencing nerve symptoms, many healthcare providers, myself included, recommend significantly higher doses, often in the range of 1,000 to 2,000 micrograms per day, or even higher in some cases. And this might sound like a lot, but here's the thing about B12. It is one of the safest vitamins in existence. Because it's water-soluble, your body simply excretes what it doesn't use. There is no known toxicity associated with high doses of B12 supplementation. The upper tolerable limit isn't even established because the risk of harm is so minimal. So unlike fat-soluble vitamins, where you can get into trouble with high doses, B12 supplementation is considered extremely safe. Now, the form of supplementation also matters a great deal, and this is a nuance that most people never consider. Because of the absorption issues we discussed earlier, specifically the reduction in stomach acid and intrinsic factor production that happens as we age, simply swallowing a regular oral B12 tablet may not be the most effective approach for people over 60. Here's why. If your body can't properly absorb B12 through the normal digestive process because you don't have enough intrinsic factor, taking a tablet that goes through your digestive tract might not get the job done effectively. So, what are the alternatives? There are several forms of B12 supplementation that can actually bypass the need for intrinsic factor and get absorbed more directly into your bloodstream. Sublingual tablets or liquid B12, these dissolve under your tongue and absorb directly through the mucous membranes. The research on sublingual B12 is actually quite positive, showing that it can raise B12 levels effectively even in people who have absorption issues. Nasal sprays are another option. B12 nasal spray allows the vitamin to be absorbed directly through the nasal mucosa, bypassing the digestive system entirely. And then there are B12 injections, which are the most direct method and are sometimes used in clinical settings for severe deficiency. B12 injections go directly into the muscle and are absorbed into the bloodstream without any digestive processing whatsoever. If you're severely deficient, or if oral and sublingual forms haven't worked well for you, talking to your doctor about B12 injections is absolutely worth doing. I also want to address something that I think is really important, and that is the question of testing. Before you start supplementing, ideally you want to know where your B12 levels actually stand. Now, the standard blood test measures what's called serum B12, and this is a reasonable starting point. But I want to be honest with you about the limitations of this test. The normal range that most labs use is somewhere between 200 and 900 picograms per milliliter. But a growing body of research suggests that many people experience neurological symptoms at levels that technically fall within the normal range. In other words, you could have a B12 level that your lab report says is fine, but that is actually insufficient for optimal nerve function. This is why some practitioners also look at other markers like methylmalonic acid and homocysteine, which are more sensitive indicators of functional B12 deficiency. Elevated levels of these markers in the blood can indicate that your body isn't processing B12 effectively, even if your serum B12 looks okay on paper. I would strongly encourage anyone over 60, especially if you're experiencing nerve symptoms, to talk to your doctor about getting a full B12 workup, including not just serum B12, but also methylmalonic acid and homocysteine if possible. This will give you a much clearer picture of where you actually stand. Now, while B12 is the star of today's conversation and arguably the single most important vitamin for nerve health in people over 60, I want to take a moment to talk about some important supporting players because nerve repair doesn't happen in isolation. It's a complex biological process that benefits from multiple nutritional factors working together. And understanding this can help you optimize your results. B12 works very closely with two other B vitamins in particular: folate, which is B9, and B6. These three vitamins work together in a biochemical process that is critically important for nervous system health. They work together to regulate homocysteine levels in the blood, and elevated homocysteine is directly associated with nerve damage and neurological dysfunction. So, making sure you're getting adequate folate and B6 alongside your B12 is really important. Many people find it most convenient to take a comprehensive B-complex supplement alongside their standalone B12, especially methylcobalamin. Alpha-lipoic acid is another nutrient that has impressive research behind it for nerve health. It's a powerful antioxidant that has been shown in numerous studies to reduce neuropathy symptoms, including pain, tingling, and numbness. The research on alpha-lipoic acid and diabetic neuropathy in particular is quite robust. Omega-3 fatty acids are also worth mentioning because they support the structural health of nerve cell membranes and have anti-inflammatory properties that can help reduce nerve pain. And vitamin D, which is another nutrient that the majority of older adults are deficient in, plays a significant role in neurological health and immune function. And low vitamin D levels have been associated with peripheral neuropathy as well. But even as I acknowledge these supporting nutrients, I want to come back to the central point. If you're over 60 and you're experiencing nerve symptoms and you haven't had your B12 levels checked and you haven't tried methylcobalamin supplementation, that is where you need to start because B12 deficiency is so common in this age group, so correctable, and so directly linked to the kind of nerve symptoms so many of you are experiencing. It is absolutely the priority. Let me tell you what you might realistically expect when you start supplementing with methylcobalamin if you are indeed deficient. In the first week or two, many people begin to notice subtle changes. They might notice that the tingling feels slightly less intense. They might notice that they're sleeping better because nerve pain often disrupts sleep. They might notice a little more energy, which makes sense because B12 is also critical for red blood cell production and energy metabolism. By weeks 3 and 4, if deficiency was a significant factor, the improvements often become more noticeable. The numbness may begin to lift. The burning sensations may decrease in frequency or intensity. Some people report that their balance feels a little better, which makes sense because the nerves that control proprioception, your sense of where your body is in space, are also affected by B12 deficiency. Over months of consistent supplementation, the improvements can be quite significant. Remember that nerve repair is a slow process by nature. Nerves regenerate slowly, but they do regenerate, and consistently giving your body the nutrients it needs to support that regeneration is the key. I also want to talk about lifestyle factors because I would be doing you a disservice if I only talked about supplementation without acknowledging that what you eat, how you move, and how you manage certain health conditions also plays a major role in nerve health. In terms of diet, focusing on foods that are naturally rich in B12 is important even if you're supplementing, because food provides B12 in forms that work synergistically with other nutrients. The best dietary sources of B12 are animal products: meat, poultry, fish, shellfish, eggs, and dairy. If you're eating a plant-based diet, you need to be especially vigilant about supplementation because B12 is not found in plant foods in meaningful amounts. Nutritional yeast is sometimes mentioned as a plant-based B12 source, and some varieties are indeed fortified with B12, but this alone is usually not sufficient to maintain adequate levels. In terms of exercise, even gentle movement is incredibly beneficial for nerve health. Exercise improves circulation, and good circulation is essential for delivering nutrients to nerve tissue and removing inflammatory waste products. Even walking for 20 to 30 minutes a day can make a meaningful difference over time. Research has shown that regular exercise can actually help stimulate nerve repair and reduce neuropathy symptoms, so please don't underestimate the power of simply moving more. Blood sugar management is also critically important. Even if you don't have diagnosed diabetes, blood sugar spikes and chronically elevated glucose can damage nerve tissue over time. This is why I often recommend that people over 60 pay close attention to their diet, minimize refined sugars and highly processed carbohydrates, and consider getting their fasting glucose and A1C checked if they haven't done so recently. And managing inflammation is another key piece of the puzzle. Chronic low-grade inflammation is extremely common in older adults and is a significant driver of nerve damage. Anti-inflammatory lifestyle choices, including eating plenty of colorful vegetables, getting regular physical activity, managing stress, getting adequate sleep, these all contribute to creating an internal environment where nerve repair is more likely to occur. Now, I want to address something that I think is really important before we wrap up today, and it's the question of expectations and patience. We titled this video, Repair Nerve Damage in 2 Weeks, and I want to make sure you have a realistic understanding of what that means. 2 weeks is when many people who are deficient in B12 and start supplementing begin to notice the first signs of improvement. 2 weeks is when the research shows that nerve conduction can begin to improve. But true nerve repair, the actual structural regeneration of damaged nerve tissue, is a longer process. Nerves regenerate very slowly, at a rate of roughly 1 to 3 millimeters per day under favorable conditions. So if you have significant nerve damage that has been building for months or years, you should not expect to be completely symptom-free in 2 weeks. That would be an unrealistic and unfair expectation to set. What is realistic is that in 2 weeks, if B12 deficiency has been a factor, you should begin to notice some improvement. And with continued supplementation and the lifestyle changes we discussed, those improvements should continue to build over the following weeks and months. The key is consistency. The key is not giving up after a week because you don't feel dramatically different. Nerve repair is a marathon, not a sprint. And the most important thing you can do is commit to giving your body the consistent nutritional support it needs every single day. I also want to emphasize, and I cannot stress this enough, please work with your healthcare provider on this. While B12 supplementation is extremely safe, and I absolutely recommend it for anyone over 60 who is experiencing nerve symptoms, it is important to get properly evaluated. Peripheral neuropathy can have multiple causes, and some of those causes require specific medical treatment beyond nutritional supplementation. Diabetes, thyroid disorders, autoimmune conditions, certain infections, toxic exposures, even some cancers can cause neuropathy, and these need to be properly diagnosed and managed. B12 supplementation can be a powerful part of your nerve health strategy, but it should be part of a comprehensive approach that includes working with your doctor to understand the full picture of what's going on in your body. Please don't use this video as a substitute for medical advice. Use it as a starting point for a conversation with your healthcare provider. Bring this information with you, ask to have your B12 levels tested, ask about methylcobalamin specifically, be your own advocate, and if your doctor dismisses your symptoms without proper investigation, it is absolutely okay to seek a second opinion. Alright, let's bring this all together because I've covered a lot of ground today, and I want to make sure you leave with a clear, practical takeaway. If you are over 60 and you are experiencing nerve symptoms like tingling, numbness, burning, or weakness in your hands or feet, the single most important thing you can do right now is get your B12 levels tested and consider starting methylcobalamin supplementation after discussing it with your doctor. Methylcobalamin is the active, most bioavailable form of B12. Look for sublingual tablets or liquid drops for better absorption if you're concerned about digestive absorption issues. A dose in the range of 1,000 to 2,000 micrograms daily is commonly recommended for people with nerve symptoms, but work with your healthcare provider to determine the right dose for your individual situation. Support your B12 with a good B complex supplement. Consider adding alpha lipoic acid and omega 3s. Make sure your vitamin D levels are adequate. Clean up your diet, move your body every day, manage your blood sugar, and be consistent. Give your body the time and the tools it needs to heal itself, because it absolutely can. I am Dr. Harper Collins, and every single video I make on this channel is aimed at giving you the real, evidence-based information you need to live your healthiest, most vibrant life at every age. Because aging doesn't have to mean suffering. It doesn't have to mean accepting pain and limitation as your new normal. There is so much that can be done, and you deserve to know what those things are. If this video helped you today, I would love for you to hit that like button because it really does help this content reach more people who need this information. And if you know someone over 60 who has been struggling with nerve pain, tingling, or numbness, please share this video with them. It could make a real difference in their life. Subscribe to this channel if you haven't already because we cover senior health topics just like this one every single week, and I don't want you to miss a thing. Drop a comment below and let me know if you've experienced B12 deficiency or nerve symptoms and what has helped you, because your experience might be exactly what someone else in our community needs to hear. And if you have questions, leave them in the comments. I read every single one. Thank you so much for watching. Take care of yourselves, be consistent with your health, and I will see you in the next video.